Greetings, ladies and gentlemen. I welcome you at 77th Scientific Conference of Students and Graduates of PSU. My name is Kirill Zelenovsky and I am currently studying at the second year of Business Administration. Today I'm going to present you the topic of my scientific research, Capitalism as Utopia during the COVID-19 pandemic. So I'm going to define how the capitalists approach damages during the actual pandemic. The aim of my research is to find out why the capitalist system has significantly damaged the economic welfare of the global economy and what else can be changed to correct or at least improve the current situation. So the main goal is to find out economic connection between the current world situation and world economy direction. So the relevance of the topic is that COVID-19 pandemic is going worldwide and workers are losing their jobs and wages which lead to impossible survival conditions and fatal economic damage. First of all, let's define the term capitalism and how it could be described nowadays. Capitalism is an economic system in which a small number of people own the vast majority of material resources necessary to produce useful things. Other people, the working class, the vast majority of us, own very little or no such resources. The capitalist world's rulers would like mankind to believe COVID-19 has been an unforeseeable catastrophe. They want us to believe that the pandemic has ruined an economy which is otherwise solid. First, government allows capitalism to disuse a multi-billion-dollar taxpayer bailout and self-serving corporate executive, which quietly kicked off our current financial crisis last year, months before the pandemic started, as a rescue package for the people suffering from a historic health crisis. Second, and not the least, and perhaps more important in the long term, it enables financial rulers to avoid the truth that it was the decisions of those very same universe masters dedicated adherents to profit making that left the planet significantly unprepared for COVID-19 crisis. Socialist society, both prevention and reaction to disease outbreaks would dramatically change. Resources such as hand soap, manual sanitizer, and crowd sanitizing wipes or sprays are currently in extremely high demand. We are seeing shortages of key supplies all over the world already. Under capitalism, the need for profit maximization has led companies to raise their prices drastically in this time of high demand. Under capitalism, there is a scarcity leading to increased profit. Let's follow the historical line of COVID-19 distribution all over the world. Firstly, the virus has been diagnosed in China. The impact of the coronavirus epidemic on the Chinese economy will be short-term and will not affect the overall economic situation in the long run. Along with the gradual manifestation of the results of measures to prevent and control the epidemic, the government has confidence, resources, and conditions in order to minimize the impact of the epidemic on the economy and ensure stable socio-economic development of the country, which ensures the socialist development of the economy. The next outbreak of the virus occurred in Central Europe. In Italy and Spain, there was a significant spread of COVID-19 and the loss of labor. The European economy significantly depends on the Chinese economy, and so many factors were influenced by the COVID-19 pandemic. Even like German economy faces a recession and cannot behave as it did it before. Tourism, food industry, health, and others were influenced a lot, and still it is complicated to predict what will be in the nearest future. The largest wave overtook the United States, and that's why the capitalist role is discussed within research. Medical ventilators are the crucial device necessary to help people survive a serious infection with COVID-19. Doctors cannot do nothing without it as virus ravages the patient's lungs. And the American people now learn there is an alarming shortage of such equipment. Health officials have been aware for decades of this fragility. That's why the funds were put aside over a decade earlier and agreements were released for a new model of low-cost, portable ventilators that could be stationed in a pandemic. Hospital space is at a premium. Unfortunately, clinics were not built up exactly in excess capacity. They either cut beds, consolidate hospitals, or in rural areas. So close them down altogether. In 2019, at least 30 hospitals declared bankruptcy in the United States. Middle-class members have to market their labor to the capitalist for a salary to survive, or they have to rely on the financial assistance of someone that works for a salary. Capitalists who fail to make profits will eventually find themselves unable to sell their progress and be kicked out. Firstly, pharmaceutical firms could have begun developing a virus vaccine a year earlier. The novel coronavirus that is disseminating in the world is now actually one of family of coronaviruses we have been familiar with for a long time. Analysis on vaccines and cures for coronaviruses in particular could have been started, thus offering us a head start on treatments for the recent outbreak. Epidemiologists predict the coronavirus could kill as many as 50 million people worldwide. If humanity had a vaccine, we could have prevented many or most of these fatalities. People have no vaccine because it wasn't lucrative for enterprises to develop one. Second, the emergency measures to smooth coronavirus spread imply that most companies have to cancel operations and several employees will lose their jobs or find their hours dramatically reduced. That will be big of a deal, but not devastating. In regions where left-wing political parties and strong labor groups have constructed robust welfare states that verify some of the worst characteristics of capitalism. In contrast to countries with a stronger labor movement, Americans do not appreciate strong collective bargaining rights, no basic social welfare provisions such as universal health coverage. Capitalists focus on profit while the pandemic implies to create effective social welfare conditions for people, ensuring the safety of their lives, and do not allow people to be damaged. Need in government is a good point for discussion. People are not sure how the people who are in power will behave in such emergency situation, probably because they didn't include that point in their election campaigns. Encouraging for-profit organizations to work on doing their business ruined the healthcare institution within capitalist society. It became utopic and might even destroy the entire economic system due to lack of labor forces. Finally, I wish you be healthy. Thank you for your attention. What questions do you have?